hazardous materials. Now, anytime you work in a pharmacy, a compounding lab, a sterile hood, you're going to be dealing with some hazardous materials. And this goes on even beyond pharmacy. Anytime you're in a workplace and there's a good chance that you could be dealing with materials that may be hazardous to your health or someone else's health, you'll want to be prepared to be able to keep yourself from getting hurt or keeping somebody that you know and you work with from getting hurt as well. So in this lecture, we're going to go over a few different precautions you can take and a few different techniques that you can use as well. The first thing I want to talk about is the material safety data sheets. You'll see them called the MSDS sheets. And these provide information on the dangerous substances, the proper handling and care on the dangerous substances, and they can be found anywhere hazardous chemicals may be used. You may be, if you have someone that's coming inspecting your facility, ask, where do you keep the material safety data sheets or the MSDS sheets? So know where that is in your facility, but know what they are too. You can see a little logo here with the blue, red, yellow, and gray there on each side. And each of those colors do mean something on there, and you can check with the reference that's on top of this lecture to be able to know what each of those mean. I don't know that they'll ask you on your technician exam what each of those colors mean, but you may want to look over it just to play it on the safe side. There is an online lookup, so if for some reason you couldn't find your physical MSDS sheets, you can always look it up at this website that we have here at the bottom. In addition to hazardous materials, another danger in the pharmacy might be sharps. Now, sharps will be anything that could puncture the skin. Whenever I'm in a pharmacy, a lot of times I'm thinking needles, but that could be other things as well. It could be needles or it could be lancets. Now, lancets are the little devices that are used to puncture a hole in the finger so a diabetic person can be able to get blood from their finger and use it in a glucometer to tell what their blood sugar is. That is a lancet. They'll use the lancing device to be able to put just a little tiny hole in their finger, just enough to get a small amount of blood. Nonetheless, it touches blood products, and therefore it could be a danger to you or someone you work with. So we want needles or lancing devices or anything else that could puncture the skin, not just thrown in the trash can. That could make the custodian or the janitor, whoever's dealing with the trash, be at risk. So how do we take care of that? We use what's called a sharps container, and you can see one right here on this slide. They are red and usually hard and plastic. That way the sharp doesn't pass right through it and be able to injure somebody that's handling it. It's red, as already mentioned. It's rigid and puncture resistant, and then of course it protects yourself. Let's discuss needle recapping. Now, when possible, you don't want to recap the needles. If you happen to be putting different solutions into an IV bag, you want to put them immediately into the sharps container. Occasionally, you may find yourself having a need to recap a needle, and whenever you do so, many people will use the scoop method, and that's where you will get the needle, scoop it right in where the lid is on top of the needle, and then snap it into place. It is not a good idea to hold the cap with one hand, hold the needle with the other hand, and put the two together. You would be surprised how often you might miss and puncture yourself, in essence just jabbing a needle right into your other hand. It can hurt. If you deal with needles enough, you may indeed stick yourself. Once that happens, you definitely want to alert somebody, especially if it happens to be a needle that could have already punctured somebody else and you may have contaminated yourself or infected yourself. So the one-hand scoop method is a great method to be able to prevent that from happening. Next, let's talk about exposure, prevention, and treatment. Now, often as a pharmacist, I'll find myself giving flu shots to patients, and because of this, I need to use universal precautions. And by that, I mean, I don't just look someone up and down and determine whether I think they may have a blood-borne disease. I'm universally going to assume that everybody's blood is diseased. And that way, I don't discriminate, but maybe more importantly, I'm being ultra cautious with everyone that I touch. So universal precautions. To prevent this, I'm going to use PPE, that's personal protective equipment. Now that may be a face shield if I'm going to deal with something that you could see some splatter with, which in pharmacy that's not going to be too often, although you may wear a face mask, and that's to keep yourself breathing and contaminating some other equipment, such as whenever you're around a sterile hood. One of the more common pieces of PPE are gloves, just latex gloves. They're not as much to prevent germ spreading as much as I'm worried about any sort of blood products that may be transferred. It's almost a second skin, a second layer of protection for me. I already mentioned eye protection with a face shield, but there's certainly other things you could do, for instance, just safety goggles. Always protect yourself. Don't take the chance that you could get contaminated or infected with a needle stick or a blood spill or any type of biological hazard. Take the precautions, use universal precautions to assume that anything you touch could indeed have infective material in it. Next, I want to discuss a spill kit. Let's say whenever you're walking down the floors of the hospital that you work at and you can see a large spill of bodily fluid, whether it be blood or vomit or any other type of bodily fluid that you may see, you would want to use a spill kit. And many pharmacies or just hospitals in general will have a spill kit to use. And they'll have everything you need to be able to neutralize the spill. Some spill kits are special for acid. Some kits are special just for general spills. But be familiar that a spill kit does indeed exist. Secondly, have an eye wash station. Now here you can see an eye wash station that I have in my pharmacy. Again, I work in a compounding pharmacy and there are hazardous materials there. Because of that, we have an eye wash station. In case one of my technicians gets a caustic chemical in their eye, they'll want to get that out immediately to not do any permanent damage. So here's an eye wash station. We actually have two. Here's another one right next to the sink. Lastly, I want to show you a medical waste bag. Now, a medical waste bag, you'll notice, looks just like a regular trash bag. There's nothing really special about it except that it is red. It's not meant to keep sharps. Sharps will be in the rigid container. A medical waste bag may have bloody gauze. It may have the gloves that I just used to give a flu shot that possibly had some blood on them. Anything that may have an infective material on it. By definition, it's supposed to be if you could wring out a full drop of blood in it, then it definitely belongs in the red medical waste bag. So any potential hazardous wastes, I don't want you to just think blood, urine or feces. You also could have some communicable diseases in it as well. So don't use the sharps, as we already talked about. Those could puncture the bag. And that is a real quick refresher on hazardous materials. Be able to know about the sharps containers, the spill kits, the medical waste bags, and know that they are red in color. Okay, that would be an easy question to ask, is what color is a sharps container or what color is a medical waste bag? They are generally red in color, so be able to regurgitate that if you see that on the test. There may be some additional information attached to this in the form of just a handout or some links. So be able to look over that and just be able to really get any kind of information you can get out of this lecture or the additional material.